There we go. So good afternoon, everyone, and welcome to today's Lunch and Learn session. My name's Chloe, and I'm a Public Health Officer in the Food System team, which sits within the Public Health Division at Birmingham City Council. And today I'm going to be delivering a session about our Birmingham Eating Guidance Exploration report, which is a report that my team published back in July this year. And it's essentially a summary of existing practice, publications, and evidence that we are using to support the development of culturally diverse, healthy and sustainable eating guidance here in Birmingham. We are currently in the process of developing the resources. We've got an initial draft together of the first one that we'd like to create. And I think this is a great opportunity to kind of share with you what's led us up to the point that we are at now. And to add a little bit of background about the team that I'm in and kind of our role. So the food team, as I said, sits within the Public Health Division, and our role involves delivering the Birmingham Food System strategy, which is the city's approach to creating a bold, sustainable, healthy and thriving food system. And not only are we delivering it, the team developed the strategy, and it's the outcome of 3 years of work with partners and citizens, with the overall aim of kind of creating a strategy that will help us enable change locally and kind of shape a food system that works for all of us. And kind of thinking about what that whole system approach means and what it looks like, it means that our team kind of consider all different elements involved with food. So thinking about where we get our food from, farming, kind of how food is delivered, and kind of logistics and all that side of things. We also consider things like education and skills, which is kind of something that the Eating Guidance Project comes under, and kind of how we buy food, the cost and availability of it, kind of how we can support food businesses and so much more. So we cover lots of different kind of angles as a team, and we kind of all lead on different bits. And it also kind of thinks about how we can consider the role of different people and organisations involved in anything to do with food in our city, and kind of thinking about the impact that the food system has on everybody in Birmingham. And as my background in nutrition, one of the work streams that I lead on is the food skills and knowledge work stream, and that is the work stream that the Eating Guidance Project falls under. So in terms of the contents of this afternoon session, we'll cover a little bit about the context of Birmingham's food system, as well as thinking about what existing eating guidance is already available, and what's kind of led to us feeling like we need to create new and adapted versions of this. I'll then move on to kind of talk about the development process that's kind of led us to where we are now, a little bit about kind of changing eating behaviours, and also kind of the recommendations for action and next steps that are kind of guiding us in our work moving forward. I'll also be using, there'll be a couple of opportunities to kind of feed in today, and I'll be using Menti to do so. I've popped a link in the chat. If you haven't used Menti before, it's quite simple to use. So if you just go to menti.com and type in the code 86251845, which I'll just put in the chat now, it'll allow you to join and input some answers in when some questions come up. I'll just put that code in now. And the link is a bit earlier on in the chat. So kind of starting with looking at kind of the food system and kind of the bit of context to the situation we're in at the moment. I think it's really important to acknowledge, our city feeds lots of people every day, over 1.1 million residents, and with such a dense urban population, the food system has a huge impact on the people and environment around us. Um, Birmingham's quite known for its food sector. It plays a key part in our city's economy. It's award-winning and it has a really varied food offer, which kind of reflects the experiences and diversity of the population in our city. Through kind of doing all the work that we've done so far, we know that Birmingham has people that are really passionate about food, passionate about making a difference, and that's been really helpful as we've kind of been doing work through the Birmingham Food System Strategy. Yeah, I think it's always really important to kind of recognise that our city does face challenges. Um, we do have much higher levels of poverty and deprivation, and this can make it where, eating healthily and kind of being able to make the choice to do that is beyond many people's budgets, and can lead to people kind of choosing unhealthier options. And kind of as a result of this, we do also see quite high levels of conditions which poor diet contributes to. So, for example, we have a high proportion of people who are not currently at a healthy weight. We also have quite high levels of tooth decay in children, and also quite high levels of type 2 diabetes in our adult population. And I think really one of the things about kind of the work that we're doing and kind of a key principle of it is that we're striving for a city where we can consume a nutritious diet that helps us thrive. And I think there's many different issues that we need to address for us all to be able to do that. But kind of eating guidance is kind of one of the ways in which we can support people in our city and kind of equip them with the skills and knowledge to kind of understand what a healthy diet looks like. But more importantly, kind of how to actually achieve this in practice. So I think the first thing to start with is what actually are healthy eating guides. I think many of us have seen them before, but essentially they're kind of, a graphic way of showing kind of government healthy eating messages, essentially. And they typically represent the recommended food groups and in the suggested proportions in line with those government recommendations. A lot of them don't just think about eating, they also kind of think about wider lifestyle messages. So also looking at things kind of recommendations for regular physical activity, warnings related to things like alcohol consumption as well. And the most common examples of food guides that we tend to see kind of come in the shape of like a food pyramid or like a food plate. They're developed by kind of a team of experts who have representatives from different areas within public health and food, and also things kind of like agriculture, health, education, and people working in nutrition and food science. And in recent years, there's been an increasing number of countries that have kind of noted the importance of developing guidelines that actually promote and protect traditional food cultures and cuisines, and also kind of take into the account not only the effect that what we eat has on our health, but also kind of, that sustainability aspect and kind of the effect that it has on the environment around us. So kind of in recent, I mean, especially this year and probably this year and last year, I've noticed that there's been quite a lot of new ones being published around the world. In the UK, we have the Eat Well Guide, which was last updated in 2016, and it essentially shows us all the different foods and drinks we need to consume and in kind of what proportion. So the kind of pie chart sizes on that plate show you kind of what proportion of that food group you're meant to have. So you can see that it shows us all the different food groups. So we've got fruit and vegetables, starchy carbohydrates. So we've got our protein, so beans, pulses, fish, eggs, and meat. dairy alternatives, and also oils and spreads. Not only does it talk about food, but it also shows us how much more water we should drink, and also gives recommendations about energy intakes. You can see on the bottom there, it kind of gives the recommended average energy intake for men and women. And it also kind of depicts foods that are high in fat, salt, and sugar that we should eat less often and in smaller amounts. So that's the guidance that we currently have in the UK and that is used most frequently by health professionals. And then there are also eating guidance that is slightly adapted to suit specific groups. So this can include guidance that's specific to different communities, but also kind of specific to different health conditions. So in terms of community-specific guidance, examples include the African and Caribbean Eat Well Guide and also the South Asian Eat Well Guide. But then we also have lots of resources that are kind of put together that look at health condition specific guidance. So things like the British Dietetic Association have these quite helpful food fact sheets that can give tailored advice when it's needed in that scenario. So here's a question for everybody. As you can see, there's lots of eating guidance already there, but what would be really great to know is what healthy eating resources are you aware of or use when looking for guidance? So I'll give a couple of minutes for people to put answers into Menti. You can also put them into the chat if that's easier too. Yep, so we've got NHS guidance, leaflets and clinical areas, yep, definitely. NHS again, yep. Yep, the traffic light system. Yep, food labelling again, leaflet. WHO as well. And I think through kind of answering this question, it does kind of show that there's lots of different sources of eating guidance out there. And I think that's kind of one of the things that we're trying to look at as a team is how can we kind of centralize that information because there is so much out there. And the Eat Well guide on the NHS as well. Perfect. Thank you, everyone. So moving on to kind of the development process and why we as a team kind of felt that there was an opportunity for us to develop some new eating guidance for Birmingham. So kind of as part of our work, we kind of identified that a lot of research has found that the Eat Well guide can be quite difficult for people to understand. We had feedback that it's quite hard to follow for daily guidance. And most importantly, a lot of people noted that it wasn't very culturally diverse, and it kind of typically depicts a Western diet, which isn't very representative of what most of us actually eat. In addition, as I said, the Eat Well guide hasn't been updated since 2016. and kind of since then, many research papers and guidance documents have been published that explore diets from kind of a health, sustainability, and cultural perspective as well. And kind of from that research, there's been a lot of recommendations for action. And yeah, I think that's kind of something that we've kind of taken note of, and want to kind of include those in the resources that we develop. As I'm sure all of you know, Birmingham is a super diverse city. And as our population continues to become more diverse, resources we feel need to be developed that actually resonate with everyone. And those resources that are out there need to be easily accessible, culturally relevant, because if they aren't, it's very tricky for us to kind of change any behaviours around food. And I think there's kind of been a kind of movement at the moment to kind of move away from kind of a one size fits all approach, which has kind of been taken previously, to kind of ensure that healthy and sustainable eating guidance works for everyone. And I think one of the other really key points is that there is so much information and guidance out there around food. And I think those messages can often be conflicting and quite confusing. And we kind of saw this as an opportunity to kind of create a coordinated approach across the city, which allows for both communities and professionals who deliver healthy and sustainable eating guidance as part of their role kind of have a central place to kind of access resources and guidance that they can use. So what has the development process kind of actually involved, and what's led us up to this point now? So back in 2022, we worked with an organisation called the Diverse Nutrition Association, and they completed kind of the initial scoping for the eating guide. So they captured loads of information about different eating guidance from around the world, to kind of see what we can learn from what's already out there. And the research kind of revealed that there was a lot of interest in having resources that support people cooking cultural cuisine in a healthy way. So 31% of respondents said that they ate food from their culture every day, and 44% said 1 to 2 times a week. And also, whilst people were generally aware of the healthy eating guidelines, we had lots of feedback saying people knew what the Eat Well guide was. 73% of the respondents thought that the current healthy eating messages could be improved. And it was also highlighted that messaging needs to communicate that foods across all cultures can be part of a healthy diet, and that the recommendations kind of show need to cater for a more diverse population. The Diverse Nutrition Association also collated a kind of spreadsheet of food lists, so capturing the most common foods from each food group for 7 different regions across the world. And that was kind of our starting point at kind of looking at how we could make the foods that are represented on the Eat Well guide more diverse. So that was our first phase, and following on from that, we then kind of wanted to do some more in-depth discussions with people in the city, and this kind of, our aim was to essentially kind of collaborate with different community and professional groups to kind of explore what the best format was going to be for the guides, as well as to kind of develop recommendations on how messages should be communicated and also how those messages should then be disseminated. So the first side of this was our insights from focus groups with communities. So we worked with an organisation called Communities Engage and Thrive, who conducted 10 focus groups, which included 102 participants from a variety of different groups. So we engaged with children and young people, faith networks, ethnicity-based networks, pregnant mothers and expectant fathers, people of working age, older adults, so kind of looking at different communities and different stages across the life course. And those engagement activities kind of revealed that whilst there was, again, that kind of widespread recognition of the Eat Well guide, participants felt that it was quite outdated and kind of lacked foods from a variety of different diets. some of the key issues that they picked up on were kind of issues with kind of the visuals and appeals and presentation. In the Eat Well guide at the moment, they're kind of graphics of foods, and lots of people said they wanted to see pictures of real food, for example, and kind of real meal examples. And they also felt that the guide was quite generic and kind of lacked representation for different ages, people in different situations, and people with different health conditions. And they also thought that whilst it kind of showed what foods were healthy within food groups, they also thought that it kind of lacked enough information on nutrients and portion sizes, for example. So I think the overwhelming message was that there was a desire for something new, and they kind of felt that the new guidance needed to be more engaging and fun. And it was also suggested that, you know, different ways of disseminating it would potentially be better. So things like include working around kind of art and culture and performing arts as a way to engage with different groups across the city, specifically with children in that case. So that kind of summarised the feedback that we had from community groups. We then also engaged with different healthcare professionals in the city. So the Caroline Walker Trust engaged with a number of different groups. So this include people from allied health professions, people working within weight management services, people working within education, and of course dietitians and nutritionists. The majority of them felt that there was, again, general confusion around the eating guide, specifically reporting confusion around things like portion size, and how you actually do meet recommendations such as 5 a day. So they kind of felt that the guidance was there, but not on how somebody could actually achieve that change. Others felt that the guide conveyed kind of the wrong perception in kind of restricting certain foods or not including different cultural foods, again stating that kind of over-representation of Western and European foods. And they felt that their patients and the communities that they were working with needed further explanation of the current guide, so it wasn't a standalone resource, and that you kind of needed to have some previous level of nutritional knowledge was required to actually be able to interpret it. So they kind of felt that it was a resource that was helpful if it was being talked through by them, but if it was something that you provided to somebody, let's say after an appointment to kind of interpret on their own, that their patients found it quite tricky. They also raised a really important point about how healthcare professional training was also influential in kind of how that healthy eating advice is shared, kind of exploring how that training could be more culturally competent. And the overall consensus was that when it comes to healthy eating guides, they like them that are kind of like colourful, clear and less wordy, contain a lot of visuals kind of around like practical portion sizes, kind of giving real meal examples and pictures of real foods, and that the guidance shouldn't be just kind of limited to food. Again, should also kind of have those recommendations on kind of the wider factors in well-being. So looking at things like physical activity, mental well-being, and so on. So taking kind of a more holistic approach to that. Whilst those focus groups were going on, me and my team were also capturing insights with meetings from stakeholders in the city who were quite keen on actually piloting the eating resources with us. So this included GPs, dental professionals, and also charities who work with different communities facing health inequalities in our city. Insights from GPs, they kind of stressed the importance of conveying kind of a core set of principles and messages which apply to most. So kind of having, let's say, 5 key messages that people can really resonate with, and then after that, then tailoring further guidance for specific groups. They also raised a really good point about ensuring that the format of the resources was suitable for the setting that they're being used in. So for example, GPs often said that they the information that they send would be following an appointment via a text message. So therefore, in their situation, rather than always having a physical leaflet, some of them felt that a web link and, like a digital format would be more suitable when they're in that scenario. So kind of the need to have different guidance in different formats, in different scenarios. The meetings with dentists were super interesting because they noted that there was often quite mixed messaging between nutritional and kind of healthy eating advice and oral health guidance. So an example that came up was kind of in the case of fruit. So thinking about, the detrimental effects that acidic fruits can have on enamel. And they also stress the importance that it's not only the types of food that people are eating, but also the frequency and times that they're eating them, that is also linked to their work with oral health. So, for example, if you eat foods that are quite high in sugar, they said it was much better to have them at meal times rather than kind of eating them frequently as snacks throughout the day, kind of so the exposure's all at once and not over and over again. So yeah, lots of different things that we got feedback on from them too. And I think before I kind of go into this next section about eating behaviours, I think it's really important that we remember that we can kind of give all of this healthy eating advice, and kind of guidelines out there, but they won't be enough on their own to change eating habits. So I think the next step in our process and through writing this report is we were thinking about what actually influences what we eat and kind of what behaviours can we change. So I think this is a good opportunity to ask you, so going back to Menti again, so what factors can you think of that influence our eating behaviours? So again, I'll give you a couple of minutes and please feel free to put them in the chat as well. Time, yeah, I think that is a really important one. I think a lot of us in an ideal world would have time to prepare everything from scratch, but in reality, that isn't often the case. Family or individual cooking and feeding, yep. Being bored, yep, definitely. Energy and commitment, health, yep. Emotions, yep, we often associate certain foods with different emotions. Environment, yep. Cooking skills, resources, creativity, yeah, availability, cost, motivation, yep, definitely. Stress, confusion, yep. I definitely think that a lot of the feedback we've had, there's been a lot of people saying that, they get one advice from somewhere and then it's somewhere else there's something completely different. There can be a lot of confusion as well. Time again. And also health conditions that may, limit us in preparing food as well. Yeah, definitely. Lots of really good examples there. So what we did as part of the report was explored a lot of the examples that you just gave there. So on this slide here, I've kind of listed a few of them. So one of the ones we initially looked at was biology and genetics. So they play a really strong role in shaping kind of our preferences for food, and our experiences of taste and hunger. They can also affect how full we eat, so how satisfied we feel after eating, and also how our bodies digest and kind of process food. And I think it's really important to acknowledge that there's lots of difference in how we all experience and engage with food, that are down to biology and genetics. And obviously with those factors, we don't actually have control over. And I think it's really important to acknowledge that. Another thing we looked at was experience and exposure to food, and kind of the idea that, the evidence that repeated tasting and exposure is needed to develop a liking for a food. So this can mean that, you know, how familiar we are with a food, and how much exposure we've had to them across our lives has a big impact on what sort of foods we'd pick, and what sort of foods we try. It can actually take around 10 to 15 tries to develop a liking for a food. And kind of the exposure that we have, especially when we're quite young, plays a big role in our willingness to try different foods. Another big one is our senses. So how we experience food varies greatly between people based on how kind of intensely we taste things. So for some people, foods can actually taste quite different to others. So a good example is that for some vegetables may taste bitter. Also, throughout our lives, how sensitive we are to kind of the taste of things changes. So for example, when we're infants, we have about 30,000 taste buds kind of all throughout our mouths. But by the time we hit adulthood, we only actually have about a third of these. So eating is a really intense experience when we're really young. We also have, as was mentioned, emotional associations with food, and how we experience these emotions can kind of be impacted by nature and nurture. So kind of food plays a really important role in kind of our identity, kind of how we interact with people, our memories, and we kind of, you know, often associate certain foods with different life events and different celebrations. There's also kind of social factors. So often we kind of our social networks, for example, kind of influence what we eat. So thinking about what we eat with our family and friends, etc., and they play quite a big role in our eating habits. And of course, I think it's really important to kind of think about factors such as food availability and accessibility. As I was saying earlier, that can be a barrier for people within our city. Also thinking about the food environment around us. So what supermarkets can we access? What sort of food outlets are around us? Also kind of time, finance and resources. And there's been a lot around kind of the commercial determinants of what we eat as well. So thinking about what foods are advertised to us, and what foods are marketed towards us. So all of that influences our diets. So yeah, kind of going back to that point, the resources and kind of interventions that will be developed kind of need to consider all of these different factors as well. You can't just, the guidance can't just say this is what a healthy diet looks like, these are the sort of foods. It also needs to kind of consider the determinants of eating behaviours and food choices as well, which is quite a big task. And we also kind of need to think about how we can actually achieve behaviour change. So Sarah in my team, who was working on this project with me, has a really strong background in behavioural science and has been doing a lot of work into this. So I'll try to do my best to kind of explain the work that she's been doing. But she's kind of been looking at the Achieving Behaviour Change Guide, which was developed by behavioural scientists and kind of provides a structured approach to achieving behaviour change. And it's based on a framework known as the behaviour change wheel, and it can be used to kind of help us develop interventions from scratch or kind of build on things that are already there. And it essentially kind of involves a number of different processes to achieve behaviour change. So the first one is assessment, so thinking about you know, is what we're trying to do acceptable, practical, effective, affordable. It then looks at kind of behaviour selection. So this includes kind of identifying a behaviour to target, as well as the group or groups of people being that we're working with. And then it also involves a COM-B diagnosis. So the COM-B model essentially kind of proposes that for any for anyone to kind of perform a particular behaviour, they must have the capability, opportunity, and motivation to be able to do so. So thinking about capability, we need to think about, does somebody kind of have the physical and mental ability to engage in the behaviour? So do they have the knowledge, kind of the skills and mobility to be able to do so? Opportunity, so thinking about, are they in an environment that supports that behaviour? And then also thinking about kind of motivation. So what are those motivating factors that helps them to be able to kind of make that change? And also thinking about what other barriers there are that are preventing them from doing it in the first place as well. So taking all of that information together, at the end of report, we kind of summarised a number of recommendations for action, which are essentially kind of guiding what we are doing now in the actual development of the resources. So the first recommendation to take forward was to develop guidance for various groups. So we kind of had that emphasis on having kind of those core messages that were applicable to most, but then moving away from that and having that tailored approach following on from that. So producing tailored healthy eating guidance for various groups include looking at considering culture and faith, different circumstances. So thinking about, advice during pregnancy, advice for people who are very physically active, advice for people who have different work patterns. Also considering how we can translate that advice for different diets. So thinking about vegan diets, vegetarian diets. Again, looking at health conditions, so diabetes, hypertension, and other food-related conditions. Also looking at life stage and also things such as additional needs, so thinking about literacy levels and kind of learning needs. So I think there is a massive scope for how many different tailored guidelines there could be. And as a team, we won't be able to do all of them, but hopefully this can kind of be a bit of a rolling programme where we kind of develop more tailored guidance over time. The second recommendation for action was to develop resources for different professionals and different settings. So looking at how we could develop resources which suit the needs of GPs and other health professionals. Also thinking about how we can work with teachers and educational professionals, and also looking at how we can engage in community settings. So this might be faith settings, youth centres and food aid projects across the city. And then the third one was, when we are doing this, we need to utilise a variety of different communication and delivery methods. So thinking about how there could be a mix of traditional, methods, so kind of like leaflets and newsletters and posters, etc. But also think about how we can make the most of kind of digital communication channels as well, such as kind of social media and kind of interactive resources that are online. Also thinking about how we can translate those resources into multiple languages, and also thinking about how we can make them less wordy with kind of visual aid portion sizes such as hands and palm visuals. There was also kind of the link between kind of providing training for healthcare professionals and how to use them. And how that was kind of vital for kind of the use of the new and existing resources. The fourth one was how we can also include promotion of sustainable diets, so including recommendations on what diets should consist of in terms of sustainability, in line with kind of the widespread recognition and kind of movement at the moment for eating guidance to also consider how they can support the health of the planet as well as our bodies. And the fifth one was also thinking about how we can kind of develop the skills and knowledge to actually put in to practice that healthy eating guidance. So including information such as kind of food swaps that you can do, ways that you can reduce cost. So for example, with fruit and vegetables, using things like frozen or tinned rather than fresh, while still getting the nutrients that you need. Also, rather than just kind of, having that typical eating guide that kind of just shows you the food groups and what proportions to eat them, also having healthy recipe guidance with ingredients that we know are readily available to people in the city, and also providing guidance on things like cooking methods and techniques. So things around kind of how can you reduce salt content, so flavouring with herbs and spices instead of salt, and also other methods kind of like baking rather than frying and so on. So that kind of summarises kind of the process that took us up to where we are now, and also the recommendations that we are following at the moment. So where we're at now is we're in the third phase of the project, and we are actually developing the resources. So at the moment we are focusing on the core healthy eating resource, which captures kind of key universal messages kind of associated with a healthy diet, in line with the recommendations that we have in the UK at the moment. We've got an initial draft of this ready, which is currently being reviewed by dietitians and nutritionists working in the city, who are giving us feedback on that. We'll then move on to developing the adapted versions to support different communities and different professionals across the city. We're really hoping that in this phase we can connect with you. So if this is a project you're interested in supporting and we're getting involved with, please drop me a message or an email after this meeting. And we've also connected with quite a few other local authority public health teams throughout the entire process, and looking at how they could potentially pilot resources for us with their communities to kind of expand the reach and impact of the project. So I think that sums up everything from me today. I just want to say a big thank you to all of you for attending and engaging with today's session. And please keep an eye out for updates on our Birmingham Food Revolution pages. I'll just stop the recording here, and if anybody has any questions, please feel free to ask away.